Hello, I'm Mary Beth Lindstrom. I use she, her pronouns. This is What's My Age Again? Why Evidence-Based Sex Health Benefits Aging Adults for the Masters and Johnson Symposium sponsored by the Sexual Health and Education Specialization of Washington University and St. Louis's Brown School of Social Work. This symposium is not intended for audiences under the age of 18 due to the discussion of sex and sexuality. All right, let's get started. I thought this was a good introduction to why addressing the sexual needs of aging adults was important. It reads, sexual intercourse is kicking death in the ass while singing. To start, there is a societal belief that as we age, we stop having sex. This isn't true. However, the majority of information around safe and satisfying sex is centered around people of reproductive age, and it belies a belief aging adults already know everything there is to know. Despite an increase of 129% in Americans over the age of 60, in which a vast majority of them are still sexually active, policy initiatives that address other critical components around aging and keeping people healthy does not mention sexual health at all. Though aging adults report a lack of knowledge similar to young people, they were less likely to discuss their sex concerns with healthcare providers. Similarly, healthcare providers reported reluctance to bring up these conversations or to screen for STDs and STIs. Ageism may also play a part in how we treat aging members of society and why they are left out of sexual health spaces. Ageism betrays a societal belief that aging adults become asexual as they get older and therefore do not need this information. So, where do aging adults get their sexual health information? A study found most got it from their parents or school friends when they were younger, and others got none at all and learned as they went. As they aged, they reported books and pamphlets, as well as healthcare providers, as being good sources of information. Aging adults also reported finding current information that centers around reproduction as being unhelpful, and were also generally uncomfortable bringing sex up as a topic. Older women especially noted that their physicians do not ask about their sex lives, but that they would be willing to discuss their needs if their physician brought the topic up first. Additionally, rates of STDs and STIs have risen 23% in adults over 60 compared to the 11% of young people over 13. Complications of STDs and STIs may increase in aging adults' risk for heart disease and cancer, and though it does not appear to always be screened for, HIV rates seem to also be on the rise in this community. Alongside STDs and STIs, a third of adults over 60 had at least one complaint about their sexual functioning. Of those, 60% were still interested in maintaining their sexual activity. Sexual dysfunction may vary between those who identify as men and women. Women report difficulty maintaining lubrication, orgasming, and having general unmet sexual needs, while men were more likely to experience erectile dysfunction as their primary complaint. Additionally, individuals in the LGBTQ+ community may conceal their sexual orientation from their care providers or family members because they fear rejection. Those who are out may also face stigma from care providers, which interferes with their ability to address questions around sex or sexual functioning or get accurate information about sex. Stigma and concealment all add an extra layer of dysfunction that may play a part in how often an individual engages in sex and the level of satisfaction that they feel. A satisfying sex life is correlated with good health. Excluding aging adults from access to evidence-based information does more harm than good. So why is this important? A healthy sex life is important for everyone who wants one. Aging adults are still having sex. Evidence suggests that sexual desire for aging individuals persists well into old age, and it consists of more than just penetrative activity. Sex is also strongly correlated with better overall well being for those who are engaging in it, which makes it so important to help facilitate for those who want it without making people jump through hoops. Sex is also integral to a person's overall quality of life. Healthcare providers and other caregivers for aging adults can assist them by staying informed of their needs when it comes to having sex. Additionally, this information can be empowering for aging adults. And lastly, as is recommended for younger individuals, remaining sex positive when working with aging adults is important when attempting to create an environment that builds trust and doesn't rest on judgment or stereotypes. Like all individuals with comprehensive information about sex, aging adults are less likely to engage in risky behaviors, which may lower the incidences of STDs and STIs among aging adults. They also report fewer dysfunctions when their healthcare providers provide this information as part of just routine visits. Aging adults also report overall satisfaction in their sex life, and care providers such as doctors, nurses, therapists, and other professionals who work with aging adults report more positive attitudes towards aging adults and their sexuality when they have this robust factual information. Finally, a healthy and satisfying sex life is correlated with higher life expectancy, higher cognitive function, and like I keep saying, just better overall well being. In summary, though factors such as aging, declining health, and biases like ageism or homophobia may impact an aging adult's sex life, there are factors that can mitigate those outcomes. Care providers should keep themselves informed of the growing body of research that demonstrates the positive relationship between sex and aging in order to best support aging adults, as well to ensure that they're providing current and factual information. Aging adults are still having sex and they report that they enjoy it. Receiving sex positive education throughout a person's life course is important to facilitating continued sexual enjoyment, and it shouldn't stop when a person is no longer capable of reproducing. Finally, engaging in this information doesn't just benefit aging adults, but it improves the attitudes of the people who are working alongside them, which is good for society as a whole. That concludes my presentation. Thank you so much for taking the time to hear me today. If you have any questions, you can find me here. Please feel free to reach out and send me an email. Thank you so much.